Hello and welcome back to my YouTube channel, simply called Angela Williams. If you're just not joining me, I am talking about my broken ankle journey. I actually broke my ankle about 2 years ago, I think April of 2019. And where I left off last was I had just went to my second follow-up appointment with the orthopedic surgeon about a week after I had broke the ankle, see if I can have surgery. And can't have the surgery unless some of the swelling goes down in your ankle. Well, a lot of the swelling goes down in your ankle because it makes it hard for me to get in a little tiny space to do surgery. So anyway, he said, hey, you can have the surgery. So April the 24th is my surgery date. It was my surgery date. So now I'm picking up from there. Now this is going to be, I'm picking up from the day of the morning of the surgery, So anyway, so like I said, it was not at a hospital, it was at an ambulatory surgical center. But anyway, they gave me my pre-op stuff. I talked about that the last video. If you haven't watched that, please go back and watch that. So anyway, now I'm picking up the day of the surgery. So I woke up that morning, was nervous, excited, because I had problems coming out of being under anesthesia. So I didn't know if I was going to have general anesthesia or local anesthesia. So general anesthesia is when you're all the way out, and I have trouble coming out of that. So it was very important for me to make sure I talked to anesthesiologist before we started surgery. But anyway, so got up that morning, got dressed, hobbled on down the stairs on my butt. If you haven't watched that video on how to get up and down the stairs on your butt, go back and watch that one too. If you're scared to use your crutches like I was in the beginning, but later on, tried it, but I did it one time with the crutches going up and down the stairs, but I decided to just do it on my butt. Anyway, so get ready to go do the surgery that morning, and I'll show you, I'll flash a picture up on this screen to show you what I look like. I was in the wheelchair, honey. I was like, you know what, I'm not taking the crutches. So I was in the wheelchair, plus you're gonna be under a lot of medication coming out. So I had the wheelchair. Child, I had gained weight just in that short amount of time, but I was looking real crazy. My husband took the picture. It's just not a good picture, so I'm just gonna flash it up here real quick so you can just see how excited I was about having that surgery that morning. But anyway, we get there, you check in and all that stuff, take care of the financials, insurance, paperwork, stuff like that. So that's why they want you to get there a little earlier. I think my surgery time was 8:30. Had to be there at 6:30 in the morning. One of my sisters and her husband, they was gonna come there, but I think they got there. I didn't get to see them before they took me away to get ready for my surgery. They came like after, but they had told us they was out there, in the waiting room. It was like we already went back, and so my husband did a video just so I thought he was doing I thought we were taking a picture, then I thought he was doing a duo video. He was like, no, I'm just doing a video. I thought that I was gonna get to talk to my sister and brother-in-law. But anyway, he did like a little video, and this was after they had came in and gave me what I call my happy juice. This is like the pre-juice to get you calm and relaxed for the surgery itself. So I'm gonna stop this video and I'll show you that video when I'm got my happy juice and I'm talking to the camera, to my sister and my brother-in-law. Okay, so see you back. Stay tuned. Don't go nowhere. They on there?
No. I'm recording.
Oh, I thought we was doing duo.
Oh, no.
Hey, you guys. They give me a little something just to relax me a little bit, but this is not the heavy duty stuff. Just talk to the anesthesiologist. So y'all wish me well. I love you guys. I'll see you soon. Okay, welcome back. All right, so talk to them, and then the anesthesiologist comes in. You see the anesthesiologist before you see your surgeon that day, because he's the one that's going to tell you where you're going to use local anesthesia, which is just in the general area of the ankle where they're going to be doing the surgery. You're still kind of alert, or general anesthesia where you're all the way out. I prefer to be all the way out, but like I said, I was a little nervous about that. But anyway, I talked to the anesthesiologist, and I was so happy to see him. He's looking at me like, okay, I said, well, you're the one that's going to help save my life. But I was like, I hadn't had my happy juice. I was like, you're the one that's going to help save my life, and you're the more important one than the surgeon, because if you're going to determine if I come out alive or not, if I wake up from the anesthesia. He's like, okay. But anyway, I told him I have issues coming out of general anesthesia, and he was like, well, what kind of issues? And I was like, well, I think that I've been told that I have probably have sleep apnea. So I've not been officially diagnosed. And he was like, what makes you say that? Why did they say that? I said, because my husband tells me that I snore, I stop breathing like when I'm sleeping or whatever. Obviously I don't know I'm doing that, but my husband, he's like, yeah, You don't have to be a rocket scientist to know yet. That's sleep apnea. And then he's like, well, what other things, have you have problems with coming out of anesthesia? I said, it's almost like I'm choking or something, like it's something choke, like I'm choking and I just have trouble trying to breathe when I'm trying to in the recovery room. And he's like, okay. He said, that's good to know or whatever. So then he said, I think I'm going to give you, he said, we are going to do general anesthesia on you. He said, but since you told me what you told me, he said, I can, tell you, I think first he asked me, did I have a CPAP? I'm like, I don't have a CPAP machine because I have been diagnosed with sleep apnea. That's something I guess they put on as a mask that goes over you to help you breathe in and out oxygen when you're sleeping. With people that have sleep apnea. My husband has sleep apnea. He has one CPAP, but I was like, no, I don't have a CPAP machine. But anyway, so he's like, I'm gonna give you a shot behind your knee. I forgot what he called that shot, but whatever it was, he said that's supposed to help me manage my pain for possibly up to 72 hours, 24 hours to 72 hours after the surgery, after I get home. And I'm like, yay, anything to help me with this pain. Because, they going in your ankle and they putting all this hardware, pins and rods and screws, and they don't cut you. And they're going through your ligaments and tissue, and they're that small space in your ankle. So obviously that's going to cause you some pain, if you don't have something to control the pain. So I was like, yay, like that. I'm so happy. So then he was like, okay, so your doctor is actually here. He'll be coming in next to talk about the surgery. So my surgeon came in. He talked about it. He wasn't in there very long, though. And he wasn't, to be honest with you, he I guess he wasn't the nicest. He had been pretty cool up until then. I don't know, maybe then this ambulatory surgical center, they be trying to roll you in, roll you out. Like they like, okay, get them in, get them out, get them in, get them out. And I don't know if it was some problems, earlier that he was dealing with. I don't know, but he didn't make me feel too great before the surgery. Let's just say that. But anyway, so surgery doesn't take too long. I think I asked him, he said, 45 minutes if there's no problem, maybe less. But that's usually how long the surgery takes. So, and if you hadn't heard before, he had told me my ankle brace was one of the worst of the worst. Like textbook scenario, I had the worst of the worst. Like I broke all the bones, I had dislocated my ankle. So it was pretty bad for me. Some people just have like a small fracture where they don't even require surgery. They can just have a walking boot. Some people breaks are not that bad, one break, and they might require, a cast right off the bat. But for me, it was pretty bad. I had to have, several screws and rods and stuff put in my ankle to get it back in alignment. So anyway, we'll get more into that later too. I'll actually show you the hardware that was in my ankle, okay? But so anyway, so we go back, we do the surgery. Well, I have the surgery done. And y'all, when I woke up in the recovery room, the pain, that anesthesiologist lied to me. Whatever that shot he did behind my knee didn't do crap, okay? Because that pain, I think the nurse was like, hi, you're welcome, you coming through. I guess I was kind of coming through. I can kind of see the white lights, and all I know, I was in a lot of pain. And she said, and I was like, I was still like, the anesthesia had me, like I couldn't move, but I was trying to move, but I couldn't. And whatever was on my leg, my ankle, it just felt heavy. It felt like it was like 100 pounds on my ankle. And all it was, y'all, was a freaking, the hospital ice bag, because you have to keep your ankle ice. They had it on a pillow, and they had it like it was some ice, and it was in a bag over my ankle. But I swear, y'all, that dang old ice bag felt like it was 100 pounds heavy, and I was trying to get it off. I was like moving, trying to get it off, And they was like, no. They was like, no, let it stay. That needs to stay. And I was laying down, and the lady, the nurse, whoever she was, I wanted to fight her, because I was trying to lift my leg up, and she was lifting. She would put it down, trying to lift it up. She would put it down, and I was like, look, I was still out of it, but I knew something was missing me, and I think I was actually trying to hit her, but my arms wouldn't let me do it, because of the drugs still in my system. And then I think I tried to get up, and I tried to get up like this. I tried to get it, and she just used 2 fingers, and she said, and I said, oh, and she put 2 fingers. She said, no. I said, oh, it was the craziest thing, y'all. I think she even laughed at me, and she said, okay, honey. She said, we're gonna get you something. We're gonna get you something for the pain. She said, I need you to tell me on a scale of 1 to 10, what's your pain level? I said, 10. I just kept saying 10. And she said, okay, honey, we're gonna get you something. So they went and got me something. And she said, we're going to come back in a few minutes to check on you. And that pain still had not like subsided. And she said, okay. She said, on the scale of 1 to 10, what is it? And I kept saying 10. She said, okay, we're going to give you something a little stronger. So they came back again in a few minutes. And she said, what's your pain level now? I was like a 9. And she said, okay, y'all, we need some more. So they did something, gave me some other type of pain medication. She said, what is it now? I said, like an 8.5. She said, 8.5. I said, yeah, it's like an 8.5. She said, okay, we're going to try to get you down a little less than that. She said, so we can get you on out of here. So I know you're probably ready to go home. I was like, yeah. And so she came back, and I think I told her it got down to like an 8. And she was like, okay. She said, okay, that's good for now. We're going to give you something else that, you know, as you go home, it'll take probably up to 45 minutes and you should be fine. We just want to get you to a point where you're stable enough to get you in your car so you can go back home. I was like, okay. And so drinking the, then she brought me some ginger ale, I think, some ginger. She said, you want something to drink? I was like, yeah. She said, you want ginger ale or water? I was like, ginger ale. And I don't know what it is about ginger ale, but it seemed like it calmed me down. I don't know. Maybe that helps with your stomach issues with the anesthesiologist. I think, excuse me, the anesthesia. I think it calms your stomach. Like I read somewhere where the anesthesia can upset your stomach. But anyway, so they get me out. So then my husband, they go get my husband, and they get the wheelchair that I came in, and then we get me in the wheelchair. I think my sister and her husband had to leave. I don't remember seeing them after the surgery. So anyway, so they get me. The nurses finagled something with some boxes. They taped together some old boxes so I can elevate my ankle, because they was like, you gotta have it elevated. They put me in the back seat of the car, and my ankle, you know, I was like this, and my ankle was elevated, and then I could feel that other medicine that they gave me before I left, the pill medicine, not the shot they gave me in the IV, but I could feel it working. I was like, yes, I'm getting relief off of pain. I was like, okay, I can deal with this on the ride home. So you're really druggy after the surgery, and my ankle at this point, it's just wrapped back up. It's just, you know, cotton swabs or whatever, and it's just wrapped back up in ace bandages. I don't have a cast on, or I'm not in a walking boot at this point. I'm back into bandages again, the ace bandages at this point. But I have the hardware, you know, the rods and the screws to keep my ankle in place until it heals, the bones, you know, grow and heal. And so we get home, and my husband does the wheelchair, and he's like, okay, baby, because you can't get my wheelchair in the door with just one person with me in it. So he's like, okay, baby, you think if I get your walker, you'll be able to, you know, kind of get yourself in the house with the walker? So I was like, yeah, I think so. So he got the walker. I'm still a little, you know, druggy. So I got you. He's behind me. I had my walker, and I hop up in this one step, and I hop up in the next step. You know, my one ankle's up like this, of course. The other one's, my foot's down. And I get in the house, and like I said, we had a makeshift bed on a long sofa. We had to cover it with sheets and my pillows, and had other pillows to elevate my ankle. And when you come home, they want you to rest 24 hours. They want you to ice and rest 24 hours. Take your pain medication. They give you pain medication. They tell you to stay on top of that pain, because you don't want to wait till you feel the pain to take the pain medication, because it's going to take longer to manage the pain. So anyway, so I was legs elevated up on the sofa, ankle elevated up on the sofa. First 24 hours, we had to ice. I think we had to ice like every hour or something like that. Like let it ice for 15-20 minutes, take it off, another hour, ice 15-20 minutes. The first 24 hours. My husband was up all night doing that. It was crazy. And then having to go to the restroom was crazy. But like I said, if you watch my previous video about tips, broken ankle tips, I talked about the portable toilet. We had that at the end of the sofa, and I'm telling you, that's a lifesaver, because when you just have a major surgery and you on all those drugs, you're not stable, and you might slip and fall, and that's not cool. So I had that, and I told y'all in the last video I was gonna tell you about some of the medicine that I was taking prior to the surgery, and it's pretty much the same medicine you take after the surgery. One is called Oxycodone acetaminophen. That's a Percocet, and that's a form of opioid. That one I liked a lot, actually. That one makes you feel like you're floating on clouds. I don't know, but anyway, it takes care of the pain, and then you're able to sleep. So it's a good thing. And then I think later on they gave me another type of opioid, which is, I guess most people know it by Vicodin, but the name was called hydrocodone acetaminophen. But basically Vicodin. That's another opioid. That's for pain management too. Wasn't as good as the Percocet, but it did its thing. And then they gave me also 800 milligrams of ibuprofen. That helps with keep swelling down too, inflammation down. And I think, oh, the doctor also gave me, well, I took over the counter 81 milligrams of aspirin. He wanted me to take that every day. And that's to help reduce the chances of blood clots. Because you don't want to have a blood clot. Because a blood clot, they could break away and travel up to your heart and kill you, or your lungs, or your brain. Sometimes you get a blood clot, they might dissolve on their own. Sometimes they don't. That's when it's a problem. So the doctor told me if I experience any major like pain, like real, like heavy, like hard pain, like more, you know, than a nagging pain, to call him, because it could be a possible blood clot and they need to treat that like right away. Later on in my journey, they you know, because of the opioid epidemic or whatever, you know, you have to have a prescription for that first of all, but they don't give you too many of those because it's you know, it's kind of addictive. Because the doctor had asked me, do you have an addictive personality? And I was like, huh, excuse me? He was like, well, do you have any, you know, do you usually get addicted to stuff? I was like, chocolate? He was like, oh, no. He was like, okay, you're fine. So I guess they asked you that before they describe your opioids. I don't know. But later on, I got tramadol, which is another form of pain medication later on. And then I just took regular over-the-counter Tylenol. But when I was working, I took ibuprofen and Tylenol for obvious reasons, because I couldn't take the heavy-duty drugs because, you know, it makes you sleepy. But anyway, so like I said, my ankle's all wrapped up in bandages and everything like that. And during this time, I think you go see the doctor like a couple of days after the surgery. I think they just want to make sure you're okay and that the hardware is okay and everything. So then they did an x-ray of my ankle in the bandages, and I'll show a picture of that here. Then I think for about 10 to 14 days, I saw the doctor again. And he took another x-ray of my ankle, and he wanted to see, at this point, he wanted to see if I possibly could just go in a walking boot for the remainder of the time. It takes normally, I think, 4 to 6 weeks for your ankle to heal. Well, not completely heal, but up to 3 months for completely heal, I believe. Up to 12 weeks. But he wanted to see, could I go into a walking boot or if I need to go into a cast. So about 2 weeks of just, you know, being at home and healing and everything like that. If you do work, they do advise you not to be working during this time. But I was able to work from home, and I was like a software analyst, so I was able to work from home. But they do advise you to take time off from work to heal. But anyway, so during this time, during the 10 days before I saw the doctor again, you know, he's telling me eat prunes, 2 or 3 prunes a day. And I was like, can I just drink prune juice? And he's like, yeah. The reason they tell you that's because of the medicine that you're taking, all the medicine that you're taking, the opioids, you get constipated. And so, you know, you have trouble going to the restroom. So the prunes is just to help you be able to, you know, keep you regular, basically. And I eat plenty of greens and fruits, and they tell you drink plenty of water, which I did. And what else? Yeah, that's pretty much it as far as the food and everything that I did. And was working, and everything was fine at this point. But let me tell you, okay. So I went back to the doctor about 2 weeks, and he was like, okay. Yeah, he took the x-ray. He said, we're still baking. He called it baking. It's still baking. Your ankle's still baking. So I think we're going to go ahead and put you in a cast to kind of help it along, you know, to bake a little quicker for about another 3 weeks. So it had been 2 weeks after the surgery. Now another 3 weeks being the cast. And then hopefully I would get in a walking boot. And then after that, you know, have physical therapy. So anyway, so go back. I'm going to show y'all the video. I'm going to stop this video and show y'all the video of them. I think we have videos of them taking off the bandages. If not, I have pictures too. And I'll show either both or one or the other. So this was 2 years ago. We were just doing it for our own benefit. At that time, I wasn't even planning on doing YouTube videos. But I thought, you know, the things that I went through, it might help other people just to know what's coming, what to expect. And so I'm going to stop this video and merge it in. But stay tuned.
Yeah.
This is like all the skin that like you would daily
It'll be washing off.
Daisy, everybody's like, oh my gosh. I'm like, yes, we shed a lot.
Right. Yeah. Yeah.
So your skin is going to be sensitive. So if it itches, I would rub. I wouldn't scratch.
Gotcha. Yeah, that one.
I'm doing a video of your foot.
Oh, okay. Sorry. Okay, here's the ugly part coming up.
Yeah.
Need me to lift up?
Yeah.
Okay. Look at all this.
It looks like a foot.
Yeah. Let me see the staples. Get those real quick for me. Can you get a picture too?
I did.
These are the ones that are giving me hell.
Are they?
Well, no, the first few days after.
Oh.
Yeah.
Here we go. Actually, just right here.
Okay. All right.
Go. And I might just go ahead and pull this off.
Okay. Uh-oh.
Yeah, I got my glove. It's okay. There we go.
Ooh, where are the pictures? In there or in here? In there?
I did do them.
Okay.
Get both sides for me.
Yeah, Angela, all you did was have ankle surgery. What's the problem?
I mean, people really think you're supposed to be bouncing up and down.
The plate and the screws,
Okay.
and these are the two screws. And so that's the front view, and that's her ankle joint that we lined up really good. That's the hinge that's going to make her ankle work.
Right.
And then here's the side view. So
Okay.
that's the plate from the side.
Okay.
And this is that little fracture in the back that we left alone. That thing right there.
Okay.
She broke her ankle 3 times. We only fixed 2 parts. The
Right.
third part didn't need to be fixed.
Okay. Okay. Thanks, Doc. 'Cause she was asking me
Yeah,
everything.
no, I want pictures of my ankle.
Yeah.
I want to see what somebody stuck inside.
Staples yet because they have to videotape.
Hold on, let me look at it. That looks good.
It looks good.
Looks beautiful.
Okay. Good.
Any numbness?
I feel it, but I guess there's a lot of swelling.
Yeah,
or
that's
something.
normal. Wiggle your toes.
Okay.
Good. Ankle up and down. Just no, not the leg. Oops,
Oh,
sorry, not the
sorry.
leg. No, it's okay.
Oh, the ankle.
It's okay.
Sorry.
Just leave it here. I just want to see that it
No,
works.
no.
Go that way and that way with your ankle a little bit. Okay, there we go. There we go. Keep doing a little more. All right, there's a twitch. There it's going. All right, I just want to see that it's working.
Okay.
All right. Good. No signs for blood clot. So the things we worried about in the beginning. Oh, that was you had that. That was I was trying to avoid.
Right.
Yeah, I forgot. Okay, good.
Yeah, I had that already.
Uh-huh. So the things in the beginning, what I'm worried about is infection and blood clot.
Yeah.
Those are the
All right, welcome back. Okay, so you saw that the taking the bandages off is pretty graphic. I gotta put a disclaimer up there, but it's pretty graphic. You see the staples that were in my ankle, and it's part of the healing process. In my leg, leg and ankle, what they call it, a trophy or whatever. It's when you lose the muscles in your leg and everything, and it's just really skinny. It's like you have a Captain Hook leg. It's like a peg leg. That's basically what my leg looked like compared to the other leg. But anyway, you get an idea. I think they can do staples or stitches, but he done staples in mine, which is, those staples. Let me tell you something, even wrapped up in the bandages, they irritated the heck out of me, those staples. I was so ready to get rid of those staples out of my ankle. I cannot tell you. I was ready to get those staples out of my ankle. And it was itchy and everything, so it's crazy. But anyway, and they tell you not to put nothing in there to scratch, but I think a few times I kind of put my little back scratcher thing in there and scratch, just a little bit, because you don't want to risk infection because you have an open wound. That's why they tell you that. You definitely don't want to get it wet. They tell you not to get it wet too. But at this point, I got the bandages unwrapped and everything, and he's getting ready to put me in a cast. Put me in a cast for 3 weeks. So I will show a little video of him getting my ankle ready. He's trying to get it at you'll see he's trying to get it at a 90-degree angle, but it hurts. It hurts like the dickens. He's pushing on it and it hurts. And you would naturally fight back, your ankle, your foot will. Well, you don't want to go in the position you want to go. But they do that to try to save you months of physical therapy to help you, because you need to at least get it 90 degrees or to flex beyond 90 degrees to make it easy for you walking wise, going up hills, down hills, and things of that nature. But it was not fun, let me tell you. And then at the end, I'll show you a picture of what my cast looked like. You get to pick the color of your cast. I was trying to pick purple. They said they came back, they only had I said, okay, well, I'll take blue because blue is my mom's favorite color, my older sister's favorite color, but purple is my favorite color. But anyway, I'll show you a picture of that, and that'll be the end of this video. So the next video, I will pick up showing you, I'll pick up talking about, y'all, this is where it gets serious. This is where it gets serious about how your emotions and mental well-being comes into play. You know, but for me anyway, maybe everybody don't go through this, but I'm doing these YouTube videos in case somebody else is going through it. So you can understand that you're not by yourself in this journey. But at any rate, I'll pick up with you showing you the cast, and then I'll pick up showing me getting the cast taken off. We actually do have some video footage of that, getting the cast taken off, and then me actually getting into the walking boot and going home with that. And this is where it's going to start getting interesting, because then, you know, start doing the physical therapy, start trying to see, can you wear some shoes? You got to start doing exercise with your ankle. It's going to get interesting. So stay tuned and stay with me. So again, if you like what I'm talking about as far as my broken ankle journey, please like the video. Also subscribe to my channel, so that way you'll know when I post a new video, you get a notification. If you know of anybody else that can benefit from watching these videos, I created a playlist of the broken ankle journey videos, so they can just click on my playlist and they can just kind of catch up and watch the videos. I think I've done about 9 now, but anyway, thank you and take care, and God bless.
But we just have to cut before.
Let me push. Even though it hurts, let me do it. Deep breaths, relax. The more you let me do this today, it's going to save you a month of therapy.
Okay.
Really relax more. No, you're not relaxing enough. Let it go. Let it go. You're fighting me. Let it go. Let it go. I know you don't love me right now, but they'll do it anyway. All right. Better position. Keep deep breaths. Deep breath.